We know the most powerful thing we can ever do in medicine is education. And our job here is education, to try and explain the very complicated pathway and pull out the questions that most trouble patients and doctors about these drugs. Can it be possible that a less expensive drug is just as safe, just as efficacious? Especially when the trials often weren't done in the large patient numbers of the original drugs. So extrapolation, we know, is a key sticking point. And what I'd tell you, for example, is why would a trial in rheumatology be useful to us? Well, we're worried principally about immune reactions to drugs. Could it be that these are subtly different? We get anti-drug antibodies that reduce the activity or alter the safety. And in a way, remember, we're trying to discover, are these drugs different? With biosimilars, we don't want to recreate the pathway. We know that they're efficacious. We know what the side effects would be. The problem comes if we switch them over and they have a different antibody profile. So in fact, showing that they're similar switched in rheumatoid disease or used in rheumatoid disease is actually a bigger challenge technically for the drug maker than in lymphoma, when immunity is often depressed. So extrapolation is the first of our challenges. And then of course just the size of trials in general. Remember, we approve biosimilars in Europe on the totality of data, with a big weight on the analytic data. And if that proves challenging, what I'd tell viewers of the website is that there are two very good free-to-read papers in the journal for you out there, in the European Journal. And the first is called Biosimilars: What You Need to Know by Martina Weiser and colleagues from the Biosimilars Working Party. The second is about extrapolation, biosimilars, extrapolation: What You Need to Know, again from Blood Journal. And so for our colleagues, we'll say there are two options for you. One is to trust that Europe's regulators know what they're doing. 400 million patient days exposure, more than 30 drugs, 10 years of use without any evidence of a problem. Or you'll have to start doing some research yourself to satisfy yourself of the technical trials and challenges required for biosimilars to pass before we use them. And your patients will differ in their needs for that information.